I am so delighted to welcome Dr. Laurie Leitch. I'm Cynda Rushton. I'm the Bunting Professor of Clinical Ethics at Johns Hopkins University in the Berman Institute of Bioethics and the School of Nursing. And Dr. Leitch is the founder and director of an incredible program that focuses on helping people manage crises and trauma. So, Dr. Leitch.
Thank you. I'm glad to do this with you, Cynda. It's really fun to have a chance, not just fun. I mean, I feel a sort of mission when people are in such settings of distress and uncertainty to have something to offer that I think is simple to use, but quite profound in its ability to shift people into states that are healthier for their immune system. So I'm glad to be here with you.
So we are going to apply some of the elements of the social resiliency model to some of the common ethical challenges that are highlighted within the COVID-19 crisis. And we've already done an introductory video that if you want more information about the model, I would encourage you to take a look at. But for today's segment, what we are going to focus on is the issue of moral distress. And as a nurse, I have spent a lot of time with my colleagues exploring the kinds of situations embedded in this COVID-19 crisis that are actually challenging them from an ethical perspective. So for example, many people are feeling distress around how do I actually honor my ethical framework for individual patients, which is focused on their autonomy, their insights into balancing benefits and burdens in a context where now I'm being asked to enlarge my ethical framework, to prioritize in a different way the common good. And with that is a greater attention around issues of justice and fairness and equity. And how do we allocate the resources that we have in a way that benefits the people who are most likely to benefit from them? And that shift really creates a kind of dissonance and tension, and it can leave us feeling as if we might be abandoning our patients, when in fact, what we're being asked to do is to actually enlarge our ethical framework in a different way. What that does is it creates a sense of real distress that what we're actually doing and what we think we ought to be doing are out of alignment, and that's where the distress comes from. And we wonder, how can I have integrity in the midst of these situations when I feel this tension can't really be resolved, because quite honestly, we don't have the resources that we need to treat people in the way that we're used to. And that shift in not having the resources, we're a very well-resourced country compared to many others. And we're used to having the resources for whatever patients ask us to do. But now we have to have limits on that. And so it can leave us feeling distressed and having at the end of the day a kind of moral residue where we feel sometimes guilt, we may feel remorse, or kind of moral failing. And so as we try to address those issues, certainly there are lots of ways that we can think through those issues. But one of the pieces that we wanted to include in our repertoire is how we can actually use the wisdom of the body to help us be able to manage those situations in a way that doesn't leave us quite so depleted or feeling so despairing. And so what I'd like to do is to ask Dr. Leitch to speak about the social resiliency model a little bit, and to help us think about how we might use one of those skills when we're in the midst of a morally distressing situation. What would you recommend?
Okay, so I think the first thing that comes to mind is a skill, but it's also a concept from chemistry, which is titration. And titration simply means a little bit of one thing and a little bit of another thing and a little bit of one thing, so that if we're making a compound, we don't just dump compound B into compound A all at once. And typically when we are going through such gigantic questions and moral dilemmas and moral challenges, we need to figure out how to titrate what we're dealing with in a way that helps us both stay in touch with our consciences and our capacities and deal with the reality of a situation. And so it might look like this. So you're faced with this moral residue as you finish your day, and it can seem like that's all there is. Your whole attention is focused on how indignant or how grief-stricken or how ashamed or how what other big feelings that you have about what's gone on during that day. And knowing that there is definitely a reality base to it. It's not like this is some made up thing. So many people are facing this challenge of a moral residue. And yet, if you can work with your attention in these ways that titrate how long in one stretch you're in that moral residue, and then come back to it when you need to, you can create a much greater stability in your nervous system, which means that you'll think more clearly. You can make better decisions about how you advocate for yourself and your patients, how you respond to your families once you get home. And so it might look like this. So you get in your car and you start your litany of all the things that went wrong, or you're really sitting with one particular incident that just felt terrible to you. And maybe you even have an attitude about one of your co-workers because of their way of participating in that. And your attention then is riveted on that. That's your amygdala again. We talked about that in the first session. Focusing so heavily on it that then you start to feel that activation level rise in your body. And if you're tracking yourself, you know, how is it even showing up? Is your heart pounding? You know, do you have a pain in your temples that's just the pain of tension? Is there muscle tension associated with it? So you know when you start to sense those things. Or are you completely shut down and you don't notice anything? You're just really, really mad or grief-stricken, but there's nothing that you're aware of in your body. Those extremes are not good for you. So in the way of using the skill of titration is to say, okay, so I'm going to name the piece that's really gotten me to this state. I'm just going to name it. And then I'm going to shift my attention away from it for a piece of time on this trip home. Who am I looking forward to seeing at home? What am I looking forward to eating for dinner, if it's that kind of thing? And if it's hard to do that, you can shift back in time to a time maybe last week where I was in a situation that I felt really proud of, because those situations are also happening now. So we can use time. So what was happening last week or yesterday or in the morning before the afternoon took over that gave you a sense of, this is why I signed up for this work. This is what my purpose is on the planet in this moment. And that's not enough to just think about it. You drop it into your body and say, and as I really review all the details of that, I force my amygdala's attention to go to all of that piece that felt so good or that reminded me of who I am as a professional. You notice what starts to happen in your body. Does your breath deepen a little bit? Do your shoulders lose some of that tension? Or is the pull in your temples a little bit less? So if that's a good sign, you know, that's a sign of your resilience. And we're all wired with the potential for it. It's just that we have to direct our attention in these ways that override the amygdala's focus, that inhibit the amygdala's focus on what's negative. And once you get into a better balance, so then your attention can go back to that residue. but you stay in it just a little while and then you go back to something else, or you can go forward. What do I want it to look like down the road when we're further out of this situation? How do I want to imagine myself at a patient's bedside once these restrictions are loosened on us? And you take yourself into a future where you can be your absolute best self. And you notice that. You just sense into it. It's like taking a tonic for your body to allow yourself to think forward or back in ways that begin to bring your activation, your stress level down. Cut off the stress chemicals that are so toxic. So the skill of titration is really a wonderful tool to have, because it says just a little bit of the hard stuff, balanced out with a little bit more of the positives. And then you can always return. This is not about let's pretend everywhere in la la land and everything is happy. It's not that at all. It's only saying we need balance, and we can have balance by how we manage our attention.
So this is a great resource for us. And I want you to think about, the scenarios that are causing you moral distress. It might be because, for example, families are not able to visit now in the ways that they have been able to visit in the past. We have examples of patients dying alone, which for many of us is just heartbreaking because it's so contrary to the way that we usually provide good end-of-life care. And so we feel like we are somehow failing. It might be that, we have to say no to patients' requests. We just can't actually honor them. So this skill of titration gives us a place for us to be able to recognize and name the reason that this is causing me distress is because my orientation for my patient is to actually honor their choices and their preferences. And right now I can't do that. And that's what's causing the distress. So naming that and then being able to shift and titrate how much of that sense of distress, that sense of regret, am I able to hold right now? And to use the skill of titration to give ourselves a little bit of more ease in the midst.
Well, and I would add, Cynda, that it's to shift the focus from what I can't do, which is reality-based, to what I can do or what I have done. And so if one of the things you can do is to maintain a caring and sacred presence for a few moments, that's a can do. And just notice that, or, whatever else. But again, the can't do mindset is the amygdala's focus on threat. And what we want to do is shift to also, just side by side, also, what can I do, or what have I done, or what will I do in the future?
Yeah. So this shift in including in our on our awareness and our framework, what we actually have done, what we are able to do, doesn't deny the very real constraints and limitations we have. But at the same time, it does give us more resources to be able to continue to do our work. So I want to thank Dr. Leitch for joining me to discuss this issue, and we look forward to inviting you into further segments of this series.